Hi, this is Dr. Melanie Palm from Art of Skin MD in Solana Beach, California, and today we're going to be talking and demonstrating Restylane Lyft, which was just FDA approved for mid-facial volumizing. So we really use it in the apples of the cheeks, and it's also approved for around the mouth for corrections of folds such as the nasolabial fold. So we're going to show on this beautiful patient just a little bit of subtle enhancement. She looks fantastic. She's had this product in the past. But she's a new mom and we haven't done anything in quite some time, so we're going to focus in on her. So it comes as a clear gel. It's 1 cc or 1 ml in volume, and it just has really nice lifting power. So when we're using it to enhance the cheekbone area, I'm going to have you lean your head back. We use it right on top of periosteum, which is the bone. So I'm going to do a little poke on 3. Why don't you close your eyes for me? And we'll put a subtle amount just right here at where sort of the apple of the cheek, what we call the apex of the cheekbone, or the zygoma is our technical term is. And it's actually got numbing pre-incorporated into the Restylane Lyft. It goes in really smoothly. It's a particulate gel, and it typically lasts in most patients, I would say 6 to 12 months. If we're doing more than 1 syringe, sometimes patients get a little bit longer out of it. But really easy to inject, and as you go along, because there's numbing pre-incorporated into the filler itself, it makes it even a little bit more comfortable for patients. So I'm going to do a little bit back, tracing her beautiful cheekbones that she's got here. And I'm actually refluxing each time. There are some important vessels. There's something called the transverse facial vein, and there's a matching artery that do like to wind around this area. So it's always, as a safety measure, I always like to check with patients and do a little reflex maneuver to make sure that we're not near an important vessel. So that, if you look at this side, the right side, compared to her left, she's got a little bit better projection, and we've just enhanced that sort of apex of the cheek, or the top area of her cheekbone. I'm going to add a little bit in what we call the piriform fossa, which is the top of the nasolabial fold. We lose bone in this area, so a little mean poke here, 1, 2, 3. And I do reflux here because there's an important little vessel called your angular vessel, your artery or vein, which can be around here. And again, I'm depositing just a small amount, actually right on top of bone. And this helps lift the nose, because believe it or not, as we lose bony support here, our nose falls into our face. And finally, I want to add a little bit just to support her chin, and also to support this area that was shadowing, is sometimes referred to as the marionette line, or the prejowl sulcus. So a little poke here. One next door. And then finally, I would love to put a little bit in her chin. You can see she's trying to work it. She's uses her muscle called her mentalis in the chin to sort of maintain the tone and keep her pretty lit position. So I want to be able to support that. So I'm actually going to inject from underneath and deep to that, right on top of bone. We're putting a little bit of support there. So I've actually finished the right side of her face, and I'm going to let you guys go. I'm going to finish up on the left, but if you have questions about Restylane Lyft, you can give us a call at 858-792-7546 at Art of Skin MD.